My question was about, you just spoke about how AI is coming into diagnostics. And I think one of the biggest, in my opinion, challenges with that is that all we know is what we put into that model, which is based off of only stuff that we know. And well, whenever it comes to diagnostics, there is obviously the aspect of making judgments on the basis of information that we do know, but there's always something new that could potentially come out that we'd miss if we use just AI workflows that are built and trained over these models. So I don't know, I was thinking, what is the way to overcome that trend?
So it will take time. So, okay, one of the major things in MedTech space is the trust factor which comes in picture, and how much do you trust those diagnostic reports as such. So just to give you an example now, Nihon Koden has a product wherein you could give the blood sample, it will detect so many other things apart from the normal blood test. It took them so many years just to get to the stage where people would trust that element of it, the AI coming up with it. So there's so many other aspects which AI is currently operating as a black box, wherein you put in certain inputs, you expect certain outputs, and how the models are being built. The challenge, like I'm working on something like a value AI kind of a project, wherein we are building models or knowledge stacks, the way they structure it, wherein data structuring is being done by subject matter experts. And they are not coders or anything or any of that sort, so they have to understand the data so that we know what's going in the models to understand and build trust on those models. So it's getting into that stage wherein you have to build the capability of not just, let's say, your coding expertise or engineering capabilities, you also have to have medical backgrounds to evaluate those models, whether they are making sense or not, whether they are detecting the, because in, let's say, in a diagnostic, if you diagnose a patient with something, there are so many elements which are not captured as part of the data itself. So how do you match that? And that's where we are bringing in that kind of element, wherein we are incorporating the subject matter expertise, let's say health economists, the medical practitioners, to build and trust those models. And that's we are working with one of the largest pharma companies in that space. This is not MedTech, but in pharma space, wherein they are building these models, which will be it's a big 10-year project kind of a thing, where we are building these kinds of knowledge stacks and models to work on it. So while the models are being run by engineers, they are designing those, but the stacks and the data interpretations are being done by medical experts.
Can I build on that?
Yeah.
Yeah. So I talk in my circles sometimes. So if I could, one is the way we understand medicine, right, is that we made an observation, and all the observations, whether it's traditional medicine or what we have in the West, it's been the same kind of observation to result, right? So the machine doing that is no different. So in India, doctors can be quite famous, and primarily the reason they're famous is because they see more patients a day. On average, they go through 200 patients a day, right? If you see a pattern, our brains are very good at seeing patterns, way better than any AI. If you do that, if you expose yourself to that, you're going to become much better at seeing certain things. Within the context of the technologies that we're seeing, in diagnostics, for example, we have a startup who's applying this year that just pays attention to the sound that your organs are making in order to be able to see patterns for diagnostics. The fascinating element, so this is kind of like going beyond your question now, it's within diagnostics, it's how do you make healthcare cost effective, right? That's disruption. And some countries are pushing forward in this more than others because their goal, so Saudi Arabia, their goal is not to make as much money out of MedTech as possible. Their goal is to make their people happier. So they want a lot of AI in the space in order to make it much cheaper, because then that's actually, cost savings is not how you sell something. You sell something to a hospital, you basically teach them how they can make more money. 40% of all hospitals make, not in NHS, but in private, make their money from just selling stents. So there's a lot to uncover. I'm going to try not to go on a rant right now, but there's a lot to uncover in this. But I think this is just a natural step. is necessary.